you mentioned pain levels and pain scales. How do you use a pain scale in your practice, and how does that influence your treatment?
Sure. So pain scales are very different for a lot of people. And the one thing that I would implore patients is whenever you go and see your doctor and they ask you about a pain scale rating, try to be as judicious as possible in selecting your answer. Don't say, I'm having 12 out of 10 pain, because that doesn't help anybody. Right? Typically, I tell patients 10 out of 10 pain is what you can imagine it would feel like to get hit by a train. And 1 out of 10 pain is like a hangnail or a paper cut or something like that. So, what I said in the previous question was patients that have 4 out of 10 pain. Typically, that's the level of pain that we try to keep patients at or below while they're in the hospital. So I use that same level of pain to determine whether or not a patient needs more invasive conservative treatment. And then obviously, whenever the pain level gets to 7, 8, 9, 10, that's whenever it's time to move forward with surgery.
So we talked about conservative treatment, but before surgery, are there any other things that a person can do to help in their recovery so that they don't become surgery?
Sure. So as we mentioned before, exercise is the number one thing. Not only does it help with your cardiovascular fitness and your energy levels, but it also helps to increase your strength so that you can recover easier from a surgery or from conservative treatments. And exercise actually releases endorphins, which are our body's natural pain relievers. So by exercising, you can actually increase the endorphin release and you can actually lower the amount of pain. There have been plenty of studies done throughout the healthcare world that indicate that exercise is just as effective as Tylenol or Motrin in decreasing somebody's joint pain.
So post-op, what can a patient do to improve their recovery, to make that surgery a success?
Sure. So the number one thing and the easiest thing is to follow the recommendations of your surgeon. So whenever we prescribe physical therapy or a home exercise program, or if there are restrictions on you after your surgery, you need to follow them. Far too often we see patients that feel great after their surgery. So they say, oh, I'm going to go and do this. And I'm going to do squats.
Okay.
And they're clearly on their post-op instructions was do not put weight on your leg.
Yeah.
So obviously in situations like that, they can do damage. They can undo the work that we did during the surgery. So the number one thing is just to follow the instructions given to you by your surgeon. The second thing that I think patients can help is ice is a very effective pain reliever after surgery. It decreases swelling, it decreases pain. Mm-hmm. So keeping ice on it and trying to minimize the amount of activity that you do immediately post-operatively just to allow your body to start healing.
So if I've been in an accident at work or an auto accident or just a slip and fall at home, at what point should I be asking to see an orthopedic physician such as yourself?
So typically, if you are unable to put weight or pressure on a body part or a limb, that's whenever you should go in and see an orthopedic surgeon. There are some people that have pain tolerances that are really high. So my official answer to that is, if you get injured and you have pain, you should get evaluated just so that we're not missing anything and we're not taking something that's simple that can be treated conservatively and turning it into something that's more complex or requires invasive treatment.
So how about the shoulder? What's the answer there?
So if the pain doesn't go away in 2 to 3 days, I would say then it's time to go and see a specialist.
So based on your experience, would functionality of the shoulder be also a determinative factor?
It is a big factor, but there are plenty of people that can function and push through the pain and pain that can be caused by something that requires surgical intervention. And then they just make the degenerative changes or the degenerative injuries as a result of that acute injury worse and make the surgery or the ultimate treatment more complex.
Obviously, one of the primary factors that you want is a cooperative patient, one who's going to follow your instructions and work together as a team. So what suggestions do you have for a person coming to your office to be the best possible patient they could be for your practice, to be your ideal patient, and to get the outcome that you know they deserve?
So Having an injury journal or a symptom journal is a very good way of making sure you're prepared for your visit. We're going to ask you questions like, how long has this been going on? When do you feel the pain? How would you categorize the pain? Rate the pain level. And if you're having a good day or if you're having a bad day, your answers can be markedly different than what you were experiencing a few days ago or a few weeks ago. So keeping a journal and just keeping tabs of all of those who, what, where, when, why questions about your pain or about your symptoms that you're having can be very helpful to us so that you can refer to them. And the other thing is people get flustered whenever they're in front of a doctor or an attorney,
Right.
and they may forget about important things. And just having some notes there helps to make sure you get all of your questions answered so that you don't leave the office. Oh, I should have asked about this or I should have done that. I mean, we're always happy to bring you back in and do that, but it just saves you a trip back to the office.
So with my clients, I really harp on symptoms and functionality, and I really want them to give a good interval history because if people are reading that your chart. Other than keeping that kind of diary or log, do you have any suggestions for patients as to how they give you a really good interval history that's meaningful, not only for you as a physician, so you understand what's going on and what your treatment recommendations might be, but for the documentation purposes that they need?
Certainly. So anytime we add a treatment, it's important to continue with that log or that journal so that you can say, okay, I was experiencing these symptoms up until the point where I saw Dr. Braun. He prescribed ibuprofen and I started taking that regularly. And from this date, I had this amount of reduction in pain, or I had no change in my pain level. Documenting things like that are very helpful, both for me and I imagine for you.
Absolutely. What's the best way, most efficient way for a patient to communicate with your staff? Because you're a busy surgeon.
Sure.
And, sometimes, as you said, people get intimidated by our occupations, and we know that we're all busy. So what's the best way for them to communicate effectively with your staff?
So obviously the best way is in person during your office visit. But, questions will arise and new information will come up. Phone calls are certainly the best thing, just so that we can have a back and forth and we can make sure we're asking the right questions and getting all of the appropriate information. We also have email, and at our practice, we have a patient portal where patients can log into their portal and send direct messages to their providers.
What do people should know about you and your practice and your philosophy?
The number one thing in our entire practice, and that goes for all 4 of our surgeons at Bay Area Orthopedic Specialists, is we treat every patient as if they were a family member. We are not a practice that is going to push surgery or push any kind of treatment that is unnecessary. We try conservative treatments first. We keep the patient's financial positioning. We keep that in mind whenever we're making recommendations, and certainly things that are costly but are unlikely to be successful, we would steer them away from and try to get them into the best plan for their particular issue. So
obviously you're interested as a physician in their insurance, and you try to work around their insurance issues and find adjuncts and forms of treatment that your office can provide. Is correct. And we do cash pay rates at our practice, and our cash pay rates are very competitive, so much that we get patients from the surrounding 5 counties that seek us out just for our rates. But certainly, different insurances have different coverages, and there's out-of-pocket expenses for things, and we try to take that into consideration whenever we make our recommendations. So, what do you think of the Eagles? It's an unfortunate result for the Eagles, but they had a tremendous. All right. Go Eagles. All right. Thank you, Doctor. You're very welcome. Thank you.